Hi, we are from group 22. In this video, we will explain to you guys about ultrasound wave application in physical therapy. Let's meet our presenter. First, myself, Alia Shabira. Second, we have Alia Badrisha. And then we have Nur Dalina Sneha. Also, Nur Adriana Badrisha. And Wan Nurul Izzah. And lastly, Tengku Nur Alia Mashita. Let's begin with introduction. Did you know our human ear can only hear at the frequency of 20 Hz to 20,000 Hz, and we cannot hear below 20 Hz, so this frequency is called infrasound. However, we cannot also hear frequency that is above 20,000 Hz, and this frequency is known as ultrasound. So what is ultrasound? Ultrasound is a type of sound wave that has a frequency higher than the upper limit of human hearing. Ultrasound waves have been used in a variety of applications, including medical imaging and industry testing because of higher frequency. For our topic, we choose the application of ultrasound wave as a form of physical therapy, which is therapeutic ultrasound. Therapeutic ultrasound is a treatment commonly used in a physical therapy to provide deep heating to soft tissue in the body. Inside the physical therapist ultrasound unit is a small crystal. When an electrical charge hits this crystal, it vibrates rapidly and creating piezoelectric waves. So it promotes healing, reduce pain, and improve tissue function in various musculoskeletal and soft tissue conditions. The frequency range therapeutic ultrasound is between 1.0 and 3.0 MHz, with the most common being around 1 MHz. Basically, this involves leveraging high frequency sound wave to produce beneficial thermal and mechanical effects in tissue. Next, let's look to the significance of ultrasound wave in a physical therapy. Firstly, it reducing pain and inflammation. During ultrasound therapy, an ultrasound generator produces a sound wave directed at the affected area using a handheld probe. This sound wave penetrated deep into our body tissue, causing a teeny vibration, so the vibration helps to reduce pain, inflammation, and muscle spasm. Second is a scar tissue breakdown. Ultrasound therapy can help in breaking down scar tissue and adhesion, so it leading to increases mobility. Hence, reduction in scar tissue improve the flexibility and movement of the affected area. Besides, it stimulating tissue metabolism. The kinetic energy generated by sound wave is absorbed by tissue, so it increase circulation and metabolism lead to tissue temperature elevation. For the result, analgesic and anti-inflammatory effects contribute to healing.
Now we move on to the next part, which is the explanation of relevant to scientific instrumentation and application. There are several types of scientific instrument that are important in physical therapy, which is transducer, gel, and display screen. Okay, first is transducer. The transducer is a handheld device that emits and receives ultrasound waves. As you can see in the picture of transducer, it consists of piezoelectric crystal where it will convert the electric current to ultrasound waves. When we apply an electric current to piezoelectric crystal, it will start to vibrate, and the vibration will generate ultrasound with frequencies between 1.5 and 8 MHz. And then the ultrasound will reflect back to the piezoelectric crystal. When the crystals are hit by reflected ultrasound waves, the transducer will begin to vibrate, and the transducer will convert the ultrasound wave into electric current that sent back to the ultrasound machine. The electric signal is interpreted and translated into an image. Second is the gel. This ultrasound gel is a thick substance composed of water and propylene glycol. This substance allows the ultrasound wave to travel directly to the tissue beneath the skin. This is because ultrasound waves cannot travel through air very well. So, gel serves as a connector that eliminating the air and forming the bond between the ultrasound probe, which is the transducer, and the skin. The gel also allows us to obtain clearer images of the organs of interest. Lastly is the display screen. The display screen shows the visual representation of parameters such as ultrasound intensity, treatment time, and tissue temperature. This will allowing the therapist to adjust the setting as needed and ensuring that the treatment is delivered safely and effectively. Moving on to the next part, which is the application of the ultrasound in physical therapy. The video that we attach here shows the session where the therapist is treat their patients that suffer a dequar vein tenosynovitis, which is a painful condition affecting the tendons on the thumb sides of the wrist. During a session, the physical therapist applies the cooling gel to the skin over the affected area to ensure good contact between the skin and the transducer. The physical therapist moves the transducer head in a slow circular motion over the treatment area to ensure even distribution of ultrasound energy. Proper technique is essential for maximizing the therapeutic benefits and minimizing the risk of tissue damage. By using the ultrasound waves, we can help the patient to recover the injuries. Also, ultrasound waves recover the injuries by manage the pain, which is helps increasing the blood flow. It helps to heal the tissue, reduce the muscle spasm, to promote the relaxation of muscle fibers, increase range of motion of the joints, such as frozen shoulder injury, and give treatment to the soft tissue injuries like sprains, strains, and tendinitis.
On to the next part, let me explain more detail about exploration of physical therapy. Before we start, let me brief shortly about how it works. Ultrasound is mechanical sound waves above human level of hearing. However, its effects depend on frequency, intensity, and duty cycle at ultrasound sets. To start with, the frequency of physical therapy ultrasound can be set from 1 MHz to 3 MHz, which depends on the structures that we target for. Ultrasonic waves most likely to penetrate deeper into soft tissues at 1 MHz, while the effects are limited to more superficial structures at 3 MHz. Next, the intensity is the amount of power per unit area, which usually expressed in watt per cm square. As we can see from how intensity is expressed, a smaller ultrasound head and a smaller treatment area means a smaller cross-sectional area, which is cm square, and thus a higher intensity. Intensity must be set with frequency as thermal effect of selected intensity will depend on frequency. Duty cycle is the total amount of treatment time which ultrasound is actually on. Continuous 100% of duty cycle ultrasound is what we want if we are seeking thermal effects. This is because ultrasound interrupts sound wave generation. Intensity output over time is lower, resulting in non-thermal effect. Sound is an effective way to treat swelling of muscles, joints, and ligaments. This is the few of the conditions that most commonly treated with clinical practice guidelines on ultrasound. First is neck pain with mobility deficits, where the pulse ultrasound is beneficial based on weak evidence at reducing pain in short term but was inferior to mobilization. Second, carpal tunnel syndrome. Conflicting evidence exists regarding non-thermal ultrasound. Thermal ultrasound was found to be not beneficial based on weak evidence. Lastly, hip osteoarthritis. Through 10 treatments over 2 weeks with 1 MHz and 1 watt per cm square for 5 minutes, ultrasound was shown to be beneficial based on moderate evidence when used in addition to exercise and hard packs.
The next slides, we have examples of real-world implementation. There are 4 main points. For reducing pain and inflammation, therapeutic ultrasound is commonly used by physical therapists to treat soft tissue and sports injuries. Unlike diagnostic ultrasound, which sees the inside of the body, therapeutic ultrasound provides deep heating treatments to increase circulation, speed healing, and reduce pain in muscles, tendons, joints, and ligaments. This ultrasound may be used to treat bursitis and also ligament sprains. The second one, for scar tissue breakdown. After a recent surgery, your body and the surgical location might feel stiff, tight, and inflexible. In addition to getting you up and mobile, your physical therapist will also work with you to strengthen your muscles and improve the flexibility you have. This includes working with you to implement light and low impact exercises to build functional strength, and may include gentle stretching exercises to improve your flexibility as your body continues to recover. These stretching and low impact strengthening exercises are beneficial in helping you create a solid foundation to build upon throughout the recovery and rehabilitation process. Orthopedic surgery may cause limited mobility in the body part that was operated on for a period of time as the body works to recover and begin the healing process. Restoring and improving one's mobility after orthopedic surgery is an important step in helping patients make a full recovery and maximizing function. Mobility deficit can impair a patient's ability to perform transfers, walk, or perform activities of daily living. Physical therapy can help reduce muscle tightness and regain mobility in the affected region. Mobility exercises can help speed up recovery time and often includes a focus on the following areas as part of a comprehensive treatment program. Next, we have stimulating tissue repair. Scar tissue, as your body heals from the surgery, will naturally begin to form. While some of this is positive, if excess scar tissue builds up, it can reduce function and range of motion in the affected area. Physical therapy mobilizes or breaks up the scar tissue so that you can get the body part back to its normal amount of mobility. Some of the most common tissue mobilization techniques employed by physiotherapists are as follows, such as myofascial release, joint mobilization, and also the instrument-assisted mobilization. Physical therapy after a recent surgery can actually help diminish the amount of scar tissue that naturally forms as you heal and recover. In addition to simply getting you active, the soft tissue mobilization techniques employed by physical therapists will help reduce the potential for scar tissue buildup and ensure that mobility is not significantly impacted by that which has built up as a part of the recovery process. Last but not least is pain relief. In chronic pain, physiotherapy of ultrasound deals with improving extensibility of tissue, thus improving circulation that results in mobility and lessening pain. Lipus or a low-intensity pulse ultrasound may be applied to the repair of fractures as well. This therapy also leads to blood flow that enhances the curing process, not just muscles, but also joints and ligaments. Scar tissue can be softened with the help of ultrasound physiotherapy treatment alone, and thus it helps a lot in the management of the knee osteoarthritis. Physical therapists are not behind in advocating the use of ultrasound in case of frozen shoulders or say intense shoulder pain. This is usually done before performing a range of motion exercises as it helps augment the ability of your shoulder to stretch. Let's move to the next one. We have case examples which combine implementation in a real-world setting. Very common as a musculoskeletal complaint, low back pain is often recurrent and very persistent. Lifetime prevalence averages have been reported within recent studies at 65% and lifetime prevalence at 84%. Physiotherapy includes many modalities, and one of them is ultrasound therapy. This has been applied to relieve low back pain, bringing relief physiologically on many different levels. Osteopaths, chiropractors, and sport therapists also employ it in many different capacities. This is a very effective type of therapy for swollen muscles. The heat induces relaxation with degrees of effectiveness to reduce muscle pain, help you with lymph blood flow to the affected area. The working principle, the best way to try and define ultrasound therapy will be first to just imagine a small handheld prop that is smeared with a specific type of gel or cream, as well as held over or just around the problem area. Vibration occurs as it resounds, thus sending it waves through the skin and into the body. Those waves then cause the underlying tissue to vibrate, hence having any number of possible effects. For example, this improved lymphatic flow alone is responsible for the initiation of a fight against infection, enhancement of healing, and elimination of surplus fluid. All these things combine to form an excellent treatment against swelling and inflammation of ligaments, muscles, and also the joints. The possible benefits, as well as heating and relaxing the muscles, this form of therapy breaks down scar tissue and will increase blood flow. This combines to improve healing rates in affected areas, speed up slow healing in chronically affected areas, and even encourage the repair of damaged bones.
So now I will be talking about the potential benefits of ultrasound physical therapy. So ultrasound physical therapy has many advantages. So firstly, I will be talking about the relaxed tissue tension. So according to the World Health Organization, musculoskeletal conditions are the second largest contributors to disabilities across the world. Musculoskeletal pain occurs when there is damage to your muscle tissue. Muscles can become damaged as a result of regular wear and tear, overuse, or trauma. Examples of musculoskeletal issues include fractures, sprains, and dislocations. Prolonged immobilization and repetitive movement could cause this pain too. Ultrasound gives deep heat to the built-up tension in muscle tissues, which results in the relief of the tissue tension. Ultrasound affects soft tissue cell metabolism in the body. The therapeutic ultrasounds might help treat surgical wounds and soft tissue lesion too. It is suggested that the application of ultrasound to injured tissue will, among other things, speed the rate of healing and enhance the quality of the repair. Furthermore, potential benefits of ultrasound is it is able to reduce pain. For starters, therapeutic ultrasound can help to relieve the pain experiencing. While healing your body's deep tissue, the ultrasound also heals the source that is causing the pain and reduces the muscle cramp. In many cases, cramps and muscle tightness are the causes of the sensational pain. In addition, increased blood flow is also one of the potential benefits of ultrasound in physical therapy. Through ultrasound treatments, increase the blood flow around the injured area, which help to reduce any inflammation When the ultrasound increases blood flow, it makes the cells more receptive to healing fluids. This can provide relief from chronic conditions like arthritis that lead to inflammation and pain. Managing the inflammation caused by such disorders help to minimize symptoms like pain and limited mobility. Moreover, the heat generated by the treatment relaxes muscles deep in the body, and it helps to break down scar tissue caused by the injury. Eliminating scar tissue helps to improve the patient's range of motion. It also allows the patient to maintain their new range of motion for long. So now, I will be talking about the challenges of ultrasound in physical therapy. Firstly is the overheating risk. So ultrasound physical therapy has a low risk of causing complications, but exposure to low intensity ultrasound for a long period of time may cause superficial burns on the skin. However, this can be avoided by the continual movement of the ultrasound wand. So next challenges is cavitation. So cavitation relates to the formation of gas filled within the tissues and body fluids. There are two types of cavitation, which is stable and unstable, which have very different effects. Stable cavitation does seem to occur at therapeutic doses of ultrasound. It is the formation and growth of gas bubbles by accumulation of dissolved gas in the medium. They take approximately 1000 cycles to reach their maximum size. The cavity acts to enhance the acoustic streaming phenomena and as such would appear to be beneficial. However, for unstable cavitation, it is the formation of bubbles at the low pressure part of the ultrasound cycle. These bubbles then collapse very quickly, releasing a large amount of energy, which is harmful to tissue viability. There is no evidence at present to suggest that this phenomena occurs at therapeutic level if a good technique is used. There are applications of ultrasound that deliberately employ the unstable cavitation effect, which is high intensity focused ultrasound or HIFU. Last but not least, the challenges is restriction. So generally, therapeutic ultrasound is a safe treatment, but it is not recommended for certain people. Example, pregnant women. Therapeutic ultrasound is not used for problems near a pregnant woman's womb because it could put the pregnancy at risk. People who have pacemaker should also avoid close or prolonged contact with electrical devices or devices that have strong magnetic fields. These devices can disrupt the electrical signaling of the pacemaker and stop it from working properly.
I am going to explain for future development and innovation. First, ultrasounds in medical imaging and therapeutic applications. Medical imaging uses high-frequency sound waves to create images of internal body, commonly used for prenatal scan, cardiac image, and examining soft tissues. Second, for the therapeutic applications, include techniques like physiotherapy to promote tissue healings and high-intensity focused ultrasounds for non-invasive surgical procedures. For marine and submarine navigations, uses sound propagations to navigate, communicate, and detect objects underwater. For the fish findings, it helps locate fish in commercial and recreational fishing. Third, the consumer electronics in speakers, microphones, and ultrasonic sensors. Speakers and microphones convert electrical signal into sound. Speaker and sounds into electrical signals, microphones. For the ultrasonic sensor, used in smartphone and other devices. For proximity detections, gesture recognition, and biometrics. For automotive applications, parking assistance uses ultrasonic sensors to detect obstacles and assist driver in parking. For the advanced driver assistance systems, ADAS, it utilizes ultrasound sensor for various safety features such as blind spot detections and collision avoidance. Last, for the security and surveillance, intrusions detections and acoustic cameras. Intrusion detections uses ultrasonic waves to detect movement or unauthorized access in secure area. For the acoustic cameras, it identifies and visualizes sound source for security and maintenance purposes.
In conclusion, therapeutic ultrasound is a treatment that used in physical therapy. The significance of ultrasound for a physical therapy is reducing pain and inflammation, scar tissue breakdown, stimulating tissue breakdown and pain relief. Besides, the scientific instruments used in physical therapy are transducer, gel and display screen that represent parameters. These instruments also need a proper technique. Ultrasound works by a frequency, intensity and duty cycle. An example of real-world implementation is stimulating tissue repair by treating a soft tissue injuries. Next, the potential benefit of ultrasound in physical therapy are to relax tissue tension, reduce pain, and increase blood flow. All the things we do must have a challenge. The same goes to the ultrasound in physical therapy. The challenge of ultrasound in physical therapy are overheating risk, cavity, and restoration. The future development and innovation in ultrasound, sonar, consumer electronics, security, and surveillance.